Knock, knock.
Come in.
Hey, Ronnie, good morning. My name is John. I'm going to be your student nurse for the day. Let me wash my hands real quick. And could you please verify your name and date of birth for me, please?
Ronnie Richards, May 1994.
All right, thank you so much. And I am going to do your ear, nose, and throat exam. And this video is going to be recorded. Is that okay with you?
Mm-hmm.
All right. So before we get started, any loss of smell or taste?
No.
Any hearing issues?
No.
Any history of ear infections?
No.
Any painful swallowing?
No.
All right, thank you so much. So I am going to begin by inspecting the external ears. I am inspecting the alignment for skin color and for any lesions. And upon inspection, the ears are symmetric. There is no lesions and the skin color matches ethnicity. So next I am going to palpate the external ears. I am palpating the pinna and the triggers for any tenderness. Okay. Any pain?
No.
Mm-hmm. All right. Any pain?
No.
All right. So there is no tenderness upon palpation. And so next I'm going to perform the hearing exams. And you're going to help me close your one ear, and I'm going to say a 2-syllable word and repeat it after me, please.
Popcorn. Popcorn.
All right. So next I'm going to perform the Weber test using a tuning fork, and I'll begin by activating the tuning fork. And can you hear that?
Mm-hmm.
All right. Next I'm going to perform the Rene test. This is I put the tuning fork on the mastoid process and I'll activate it. And do you hear that?
Yes.
Okay. How about this side?
Yes.
All right. So the hearing tone is equal in both ears, and the air conduction was twice as long as the bum conduction. So next I'm going to examine the external ear canal, and for this I am using my otoscope, but for purposes of this video I'm going to use my pen light. And I would, in a normal setting, I'll begin by changing the cover of my otoscope and replacing it with a new plastic speculum cover. And then I'll turn my otoscope on and position my patient at a correct height for easy access to the ear. And for this, I would be inspecting for cilia and cerumen, and also identifying the tympanic membrane. And I would look with the otoscope in both ears and then record my findings. Next I am going to move on to the nose, and I am going to begin by inspecting the external nose for symmetry, lesions, erythema, and drainage. And upon inspection, the nose is midline. There is no lesions or drainage. So next I'm going to palpate the nose for any masses or tenderness or pain. Do you have any pain?
No.
Any pain?
No.
All right, patient denies having any pain, and there is no masses upon palpation. Next, I'm going to assess for patency. And could you please cover one nostril? And go right here for me. This side, please. All right, so the nails are patent bilaterally. So next I'm going to inspect the structures of the mouth and the thorax, and I will begin by inspecting the lips for any lesions and fissures. And upon inspection, the lips are symmetrical and they're pink and no fissures or crustings. And next I cannot identify any malodorous odor. Next I'm going to inspect the teeth for any decay. Could you show me your teeth, please? All right, there is no decay in the teeth. And I am going to inspect the gums and the buccal for color, moisture, and lesions. Can I check your gums, please? Okay. All right. And the gums are pink and moist. And I'm going to inspect the buccal mucosa. The buccal. All right, there's no lesions, and it's also pink. They're also pink. They're pink and moist. So next I'm going to inspect the hard and soft palates for symmetry. Could you please open your mouth, please? Okay. All right. The hard and soft palates are symmetrical, and I am going to inspect the flow of the mouth for the frenulum, lesions, and color. Could you please lift your tongue up? All right. The frenulum is intact, and there is no lesions, and I have identified the parotid glands, and I am going to inspect the anterior and posterior pillars, and next I'm going to inspect the uvula. Could you please say ah? All right. So the uvula is midline, and I will also inspect the posterior pharynx for any lesions, and there is no lesions. And yep, so that's it for my exam. Thank you.